We're 1 year into the coronavirus pandemic, and we are still learning so much about the disease. An alarming study out of the United Kingdom highlights severe long-term problems in many patients after they've recovered from the virus. Eyewitness News reporter Jeremy Baker looked into the study and has more.
Problem is, we really don't know the long-term effects of the virus because it is still so new. That's why studies like these need to be done, and we're not always going to like the results.
We do recognize that there are going to be a fair number of people that, if they've had a prolonged ICU stay or hospitalization, are going to be suffering from consequences of that long battle against the infection.
Researchers at the UK's Leicester University and Office for National Statistics found that out of over 47,000 people who were discharged from the hospital, 29.4% were readmitted within 140 days, and just over 12%, or about 1 in 8, ended up dying. The average age of each study participant was 65.
We know that a lot of people continue to have some symptoms afterwards, but one of the concerns we've had, particularly with people with more severe prolonged hospitalizations, is to what extent they may have some in-organ damage to other organs.
The study found some of the long-term complications with COVID included increased incidences of type 1 and type 2 diabetes. Almost a third of those who were discharged had respiratory problems. Many developed chronic kidney or liver conditions or heart problems, and there were increased incidences of problems with other organs of the body, especially in those patients under the age of 70 and ethnic minorities. Dr. Bowling says the diabetes is of serious concern here.
Because we have a difficult time just detecting diabetes in people from standard risk factors, so adding COVID into there is going to increase the need to be screening people for diabetes as well.
Dr. Bowling says if you had a moderate to severe infection or even just a mild one, to see your primary care physician periodically for general health maintenance. Jeremy Baker, KENS 5 Eyewitness News.